How do you hold your own online presence against the light? How do you analyze what's going on when a patient is looking for information and finds you or doesn't find you? So let's just step in the patient's shoes and see what you can do about your online presence to make sure it's a good fit, it's a good match. Now, let me tell you, before I started doing this work in medical, I worked as a journalist, and there's a parallel between what we used to do in journalism, which is reporting, telling stories, bringing information to large audiences, between that activity and what's happening in the medical field. So in the medical field, it's not just a story for the sake of a story. It's all about conveying complex information so the patient can understand it and trust this information and take the next step. So if you analyze your own online presence, how does it feel? How does it look? What does it feel like? It's an exercise you can do for yourself, and if it feels like very accurate content and it looks almost like a medical paper, a white paper, or a study, then you might be going, well, it's great content, right? So you're giving the patient exactly the information that you trust and that you believe is accurate. But this is internal communication between doctors. As a patient, I want to understand the condition. I want to understand the impact of the condition on my daily life. I want to feel that I relate to this content, that this doctor, this specialist is not just displaying scientific information. This doctor understands my position. So your content, as you do this self-diagnosis on your online presence, needs that touch, that human touch. And that needs an effort to really put yourself in your patient's shoes and look at their perspective. How do they look at the symptoms, the conditions, the diagnosis, the treatment, the surgery, and the recovery process? So that is an important ability that you want to find in whoever you work with as your marketing partner. Now, if everything looks like research on your website, then that's one thing, and someone will read through it, and it will have its function. It will not create the conversions that you're after or the leads that you need for your practice. Whereas if your content really addresses the patient's main problem, both in a verbal and a visual way, that's when you connect. That's when you start a conversation. And if your online presence needs that little bit of a makeover, just make use of our free consultation. We'll talk strategy, we'll talk about your business goals, we'll talk about what patients Google for and how we can integrate all that so your practice can grow even further.